Having a level 1 trauma center at Brenner Children's Hospital here, affiliated with Wake Forest Baptist, means that the American College of Surgeons came and spent days looking at our program, evaluating what kind of care we provide in the emergency department, what kind of care we have available in the operating room. Do we have those child-specific devices available that we can get to at a moment's notice when your child has a critical injury? They looked at how our intensive care team interacts with our surgical team, how our anesthesia team interacts with our surgical team, and looked at all that, and then applied that to standards that they look at across the nation to validate that across that entire continuum of care, from the moment your child arrives in the emergency department to the time your child is discharged home or discharged into an outpatient rehab or whatever your child needs, that is up to the highest standards of care that the American College of Surgeons deems. Pediatric trauma centers, American College of Surgeons Level 1 designated pediatric trauma centers are few and far between. We're one of a select few in the entire nation to have that Level 1 designation from the American College of Surgeons. In fact, we're the first and only American College of Surgeons designated Level 1 pediatric trauma center in the entire state of North Carolina. Maybe your child isn't critically injured, and maybe you never need that Level 1 pediatric trauma center, and in fact, I hope you never do. I'm a parent. I remember when my daughter had to have emergency surgery, and it's very difficult for even somebody trained who spent their life in a children's hospital to be on the other side of that table. But it is reassuring that when you have that level of expertise, the highest level of expertise, that even when your child may have a broken arm, a knee injury, something else that is for a family can be just as severe and just as traumatic, that we have those specialists, those pediatric trained specialists that can evaluate it, can initiate treatment. But we also have those pediatric anesthesiologists and those experts in how to provide comfort, how to provide pain control, how to provide sedation if your child needs that, so that your child's not suffering. Having that pediatric anesthesiologist means that not only are they trained in the anesthesia aspects, but they know how to dose those drugs just right for your child. They understand that those drugs need to be dosed based on your child's weight and your child's individual needs. One of our overriding philosophies at Brenner Children's Hospital is that of family-centered care, and you're going to see that in the emergency department. We have folks, nurses, doctors, who have dedicated their lives to taking care of children. They come to work every day to do that, to make it better, to make the world a better place for your child. They also understand that when a child is injured, the entire family's involved, and that family also has needs. And those folks are there to help those families understand what's happening with their child, understand what the next steps are going to be, but also to try to bring some comfort to a terrible situation that you're in. To request an appointment with one of our pediatric specialists here at Brenner Children's Hospital, please call 888-716-WAKE, 888-716-WAKE.